very interesting person. You know, half of our visits are usually taken up talking about plants and medical issues, and the other half is history. So Ruth's family is one of America's most historic families. Her roots are traced back 300 years. Her families were slaves owned by George Washington, who were then freed, you know, after his death and before Martha Washington's death. Her family is buried at Mount Vernon, and there are markers there. And we often talk about, you know, her family reunions, which occur every year. And she professionally, you know, is you know, you look at her, and I love seeing that smile every time she comes in. She's so delightful. But the wonderful thing that I like to think about is behind that easy smile, there is a very no-nonsense lady.
My sons are wonderful. As a matter of fact, my oldest son is the one who went online and found Dr. Weiss when my toes were feeling funny around December. And he said, "Mom, I think that's the beginning of neuropathy." Neuropathy? And I didn't even know what that was. And he said, "That's nerve damage." And he found Dr. Weiss online. Yeah, he's the reason. And Dr. Weiss is so humorous. One time at my appointment, I think it was in February, I said, "Dr. Weiss," I told my son, David, I was coming here. I said, "Could you say hi to him?" He said, "Now you said he was a colonel in the Army?" I said, "Yes." He said, "Well, shall I salute him?" I was like, "No, just say hi on the phone." He is so humorous, Dr. Weiss.
So you were a diabetic?
Yes, I was.
And you were taking metformin?
Yes, only one pill.
Yeah.
My endocrinologist gave me that one,
Right.
and then I refused to take any more.
Yeah, but despite that, and taking the one pill of metformin, your sugars were still not under great control.
Correct.
We were looking back, you had a hemoglobin A1C of about 7.
7.
And then you started eating your plants and refining your diet and your lifestyle. And
By May 21st, because I kept a diary.
I know you're not going to forget that day.
No, I'm not.
Right? You were not a diabetic anymore. It is a reflection of her passion that she spreads this to her community and to her church. She just can't help it.
You said, "You did the hard work, Ruth," but I said, "You did it," and you said, "I was only the messenger."
Of course, we were dealing with your high blood pressure too.
Yes.
At the same time. Now, you've been on multiple medications
For a number of years.
for a number of years. We've been decreasing them, you know, sometimes, and it depends on the individual, sometimes the medications can just fall off, you know, as they adopt the plant-based diet. Yours has been a little bit more stubborn. However, we've still made traction, and we've been decreasing them.
Yes.
And the last time you decreased one of them further, you cut the dose again in half.
Correct.
And that was the hydralazine, right? You were originally, was it 4 times a day or 3 times a day?
It was
3 times a day, 50
50
milligrams, went to 2 times a day, and now 1 time a day. And we're going to check your blood pressure.
Okay.
No pressure.
And just take this very sharp knife and pick the one you want. Let's get one of these that's a little larger over here. Okay, so what we'll do is we'll go all the way down, and then you just sort of along the soil line, slice through
Like that?
Yeah, there you go. There you go. And then we bring it up
That's beautiful.
and clean it off a little bit, turn it upside down, get any yucky leaves off. 'Cause here they'll just compost into the soil, feed the soil a little bit.
Okay.
Saves us a trip to the compost pile. And okay, so
that
there's
looks
one head
really
of
good.
lettuce.
Wow. Healthy.
Is this water?
So that's, we call that drip tape, and that's the way we water in here. And
Wow.
It feeds off our irrigation line, but what it does, so these lines have little holes in them, like every foot apart, and it just drips water out, drips it out slowly. So what it does is it doesn't waste water. It's a way to conserve water. It drips it right exactly where the plants need it. Keeps it off the leaves so plants are less likely to get diseased from being too wet. And it just deeply, deeply waters the root system using less water. Our approach is that the healthier the soil, the less pest and disease problems you have. There are always disease, spores and disease pathogens in the soil all the time. It's not like you get a disease, they're there. It's whether or not your soil life and your plants are healthy enough to fight them off. So it's like you got some bad guys in the soil, but we're trying to feed and develop all the good guys, and they simply outcompete the bad ones.
That makes sense.
Yeah.
Wonderful.
There's nothing sprayed on these. So
this would be considered organic?
oh yeah, we're certified organic, definitely.
Yeah,
But we take it a few steps beyond that, because even a certified organic, there are a number of sprays, organic sprays, plant-based sprays that you can use in an organic system, but we don't even use those. We focus on building the soil and building soil health. And then in turn, we get a better, healthier soil and healthier plants.
They really look healthy.
Yeah.
The doctor, to Weiss, he kept saying, your taste buds will change and you'll get used to it. And he was right. He was right. But I'll tell you one thing, eating this way really makes you feel terrific. And nothing hurts. Anything that was hurting doesn't hurt anymore.
Yeah, you don't have any inflammation anymore, right?
I guess that's what it is.
Add a nice spice. We can use the greens too. Let's just pull
Okay.
off the yellow greens there.
Chop them up.
Yes. Yeah, you can slice them.
I really like it. Bok choy and Swiss chard. Had never had that before in my life.
And a lot of people would get rid of the roots, but we know we just came out of beautiful soil, so you don't have to get rid of those either.
I learned about the myths about food and about olive oil is not good for you. And even leaving the tomatoes on the counter, I would always put mine in the refrigerator, but I learned you don't put them in there. Never. It's surprisingly good.
Oh, that's stuff went in there, right?
It did, but I've never done this before.
Well, I think that's pretty impressive. This is the lowest blood pressure you've ever had. With cameras watching you, with hot lights on you, and with Dr. Weiss making you really nervous. It's still the lowest blood pressure. This was 128 over 64.
Wow.
So, and that's on the reduced medication, right? So I have a feeling probably your days of taking hydralazine may be over.
Yay. Thank you. Wow. That's
Yeah.
pretty fast.
Well, plants work fast.
Oh, okay. I know you said said plants are medicine.
Yeah.
I remember you saying
Yeah.
that. We shall see.